As many as 176 countries have been affected by the novel coronavirus. Even the number of cases in India have spiked. Some countries, like South Korea, have been able to deal with it in a much better way as compared to Italy and Iran. The difference is they've been able to flatten the curve. According to the Indian Council of Medical Research, India is currently at the local transmission stage of the virus outbreak. However, if the country moves into stage 3, which consists of community transmission, they will overburden the healthcare staff, healthcare facilities, and infrastructure in the country. This can already be seen in a country like Italy. Italy has a total of 5,090 intensive care beds, which at the moment exceeds the number of patients that need them. Reports have even come up that directives may be issued to stop providing intensive care to patients above the age of 80 owing to their low chance of survival. Even in the US, the Harvard projections show that if 50% of the beds were emptied and sizable percentages of Americans were infected, the country would need at least 3 times more beds to take care of the patients. India's healthcare system may see a similar fate if the cases spike up at a high rate. Our country fares much worse compared to other top nations when it comes to medical infrastructure and healthcare investments. India has 0.7 hospital beds per 1,000 people. China had 3.8 and Italy 3.5 for the same year. Even when it came to the number of physicians per 1,000 people, India stood at 0.8, China and Italy at 1.8 and 4.1 respectively. As compared to other nations, India also falls behind when it comes to the proportion of healthcare expenditure. World Bank figures from 2016 show India spent 3.14% of general government expenditure on healthcare, compared to China's 9%, Italy's 13%, and Iran's 22%. All this means is that in addition to tackling the virus, it's also important to ensure that the healthcare professionals and the system isn't overburdened. Because if that happens, healthcare facilities will collapse. Healthcare professionals will fall ill, and there'll be nobody to take care of those who are suffering from the virus. And this is where flattening the curve comes in.
And they see this flattening the curve graph.
Flattening the curve?
Urging people to flatten the curve.
Flattening the curve essentially means using protective measures to slow down the outbreak. Hospitals will have more rooms, supplies, doctors for those who need care. In the event of an outbreak, flattening the curve is essential, as it would mean a slow growth rate in the number of cases. Even spreading out the number of cases over a longer period of time would help healthcare facilities tackle this outbreak.
This is what a rapid global pandemic looks like. Little to nothing to slow the number of new infections means a lot of people sick in a short amount of time. A slower global pandemic looks like this. The rate of new cases is lowered and they're spread out over a longer period of time. And which one of these paths that we end up on is important because of this line. It represents the capacity of our healthcare system, the number of beds, doctors, respirators, and everything else. What experts fear is a sudden explosion like this, overwhelming this capacity. And what's really interesting here is that even if these two curves represent the same total number of people that eventually get infected, in the rapid outbreak scenario, more people will die because there won't be enough hospital beds or ventilators to keep them alive.
Several practices can be implemented to flatten the curve, such as quarantining, practicing social distancing, allowing work from home, closing schools and institutions, and placing hard limits on the size of crowds at events. Out of all these, social distancing could prove to be the most effective way to reduce the spread of the virus. Social distancing refers to a set of ways to stop or slow the spread of the virus. As COVID-19 is more likely to spread from person-to-person contact, the more you isolate yourself and distance yourself from others, which is ideally 1 meter away, the lower the chance of spreading the disease. With no vaccine or specific treatment against the disease yet, this could be the single most effective way to protect yourself and others from the disease. And there's definite proof that social distancing works. Cities that suspended public transport, closed entertainment venues, and stopped public gatherings before their first COVID-19 case had 37% fewer cases than cities that didn't implement such measures. Flattening the curve also worked in the United States during the Spanish flu in 1918. Whilst Philadelphia held a massive parade right in the middle of the outbreak, St. Louis limited travel, encouraged personal hygiene, and closed schools during the same time. The difference? Philadelphia recorded 16,000 deaths over 6 months, while St. Louis recorded only 2,000 for the same period.
Philadelphia had its first case on September 17th. 11 days later, cases shot up rapidly and they overwhelmed medical facilities. St. Louis, on the other hand, the dashed line, they identified their first case October 5th. 2 days later, on October 7th, the influx was gradual, which gave doctors and hospitals time to properly care for patients and react.
As of now, the Indian government and health ministry have been able to tackle the virus quite effectively. Curfews have been issued in major cities like Mumbai and Delhi till 31st of March. And recently, the Prime Minister announced a nationwide lockdown for 21 days.
आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है.
Suspected patients are being tracked and quarantined, and travel bans have been imposed to prevent community transmission.
I think the commitment from India government, from the top level, the Prime Minister's office himself, to all sort of people in the state, I think has been enormous and has been very good and very impressive.
However, the task of preventing community transmission and flattening the curve isn't the sole responsibility of the government authorities and medical professionals. You too can contribute individually. For this, it's important for you to constantly monitor yourself, your health and symptoms to act accordingly. Just like the Prime Minister said, there's no need to rush to hospitals in the first instance. If you're showing signs of COVID-19, it's better to isolate yourself and stay at home for the first 7 days. If you live with other people, they should stay at home for 14 days from the day you got your first symptoms. This will help protect others in your community whilst you're infectious. Even after this period, if your health deteriorates, visit a hospital and get yourself tested. At this stage, social distancing is the best way of delaying the rise in cases and spreading them out over a longer period of time. India can also learn from the South Korean model on how to slow down the spread of the virus at early stages by improved testing and transparency on the number of cases to slow down the pandemic. According to the Global Health Security Index, India ranks 57th on the list of countries ranked according to the level of preparedness for an epidemic. However, in addition to the country's efforts, the onus is on you to practice social distancing, maintaining personal hygiene, and adopting self-quarantine if you feel like you have any symptoms to tackle this virus effectively. Thanks for watching Binge Daily. Be sure to thumbs up, hit subscribe, and then enable notifications with the bell icon so that you don't miss any of our upcoming videos.